Hi, my name is Stephanie Spencer. I'm a certified heart failure nurse, and I've cared for heart failure patients at Arkansas Heart Hospital's Strong Hearts Clinic for the last 16 years. If you're watching this video right now, it's probably because we've determined that you have a fluid overload problem due to congestive heart failure. There's many aspects of heart failure management that require your active participation and understanding. So with this video, I hope to give you the information that you need to successfully manage your heart failure after you leave the hospital so that you can enjoy the best health that is possible for you at home. And I want to give you the tools that you need to avoid preventable trips to the emergency room in the hospital. You should have your congestive heart failure education folder with you as you watch this video. If you don't have it, please ask your nurse for it. Heart failure is a scary sounding name for a fairly common disease, but what heart failure means is commonly misunderstood. It's not a heart attack, and it doesn't mean that your heart has stopped. Heart failure is a condition in which your heart does not pump enough blood and therefore not enough oxygen to meet your body's needs. The most common causes of heart failure are heart attacks, where the blood does not make it through the coronary arteries in order to oxygenate the heart muscle, and also high blood pressure is a common cause of heart failure, but there's many other causes. Heart failure can be caused by a virus, it can be caused by valvular problems, it can be caused by side effects from radiation, also alcohol and drug abuse, and even pregnancy can bring on heart failure. If you don't know the cause of your heart failure, it's important to ask your cardiologist or your heart doctor at your next visit. So now I want you to refer in this folder. You should have a paper called the CHF Passport to Health at Home. And at the bottom of this sheet of paper, it should have been completed by your nurse, and it's going to have some information on there that's important for you to understand how your heart failure, how this video applies to your situation. So the first thing we're going to talk about is the way we diagnose heart failure. We do that with an echocardiogram, which is an ultrasound of your heart. And from that echo, we get a number called the ejection fraction, or the EF. And your EF, or ejection fraction, is going to be listed at the bottom of your Passport to Health at Home, so you'll know what I'm talking about, how it relates to you. So basically, there are two kinds of heart failure. The first kind of heart failure I'm going to talk about is called systolic heart failure. That's most commonly caused by heart attacks, or maybe if you've had bypass surgery in the past, that might be the reason that you have this kind of heart failure. And this is the kind of heart failure that has a low ejection fraction, meaning basically under 60% is going to be a low ejection fraction. And an ejection fraction means that's the amount of blood that the left ventricle ejects out of the heart with each beat. And a normal ejection fraction is 60%. No one squeezes 100% of the blood out with each beat. So people with systolic heart failure will have a lower ejection fraction, maybe 30% or 25% or even worse than that. And so that's systolic heart failure. Then another kind of heart failure that we can have is diastolic heart failure, most commonly caused by high blood pressure. And these are the two different kinds right here. If you can see, systolic heart failure, you tend to have an enlarged heart with a thin muscle wall. And with diastolic heart failure, the heart is about the normal size, but the muscle wall is very thick. And the heart is thick and stiff, and it doesn't receive the blood well, okay? The big problem that we have with heart failure that I want you to understand, this is real important to understand going home, is that, for example, with systolic heart failure, if you have a low ejection fraction, say you have an ejection fraction of about 20%, that means when your heart ejects out the blood, you're only getting 20% out, and you're going to have 80% of the blood left over, okay? So you're going to have all this blood left over, and this is your only pumping capability in your heart. So it's really important that you don't do things like eat a lot of salt or drink too much fluid that are going to make this fluid level rise in your heart, because the next place it's going to go from here is to the top part of your heart called the left atrium, and then it's going to go right into your lungs, and you won't be able to breathe, and you'll be right back in the hospital. With diastolic heart failure, we'll frequently have backup of fluid on this side of the heart too, and the fluid will back up down low into your belly and into your legs. So these are things that we're going to work with you to try to prevent. So how do we prevent fluid buildup associated with heart failure? First, I'm going to tell you what doctors do, and then I'm going to talk to you about what you can do to prevent fluid buildup. So the first way we treat heart failure when you're in the hospital and you probably come in through the ER and you couldn't breathe, usually we're going to give you diuretics, and those are water pills, or we can give it to you IV. And so usually that's what we're going to give you to pull the excess fluid out of your bloodstream, and then you'll just urinate that out. And then usually heart failure patients are going to need to take diuretic pills when they go home. Diuretic pills are necessary, but we want to keep the doses as low as possible because it's not good for you to be on really high doses of diuretics. Then there's also medications for heart failure that we call evidence-based meds. And these are meds that research has shown make heart failure patients live longer and stay out of the hospital. I like to think of them as vitamins for your heart and for your heart failure. And they're really important to get the highest dose possible that you can tolerate because they're going to help you live longer. And if you look at the bottom of your passport, at the bottom it's going to say beta blockers and ACE inhibitors and other kinds of meds. But if you look at there, that's going to tell you what kind of meds you're on for your heart failure. So these are treatments for systolic heart failure for people that have low ejection fractions. Beta blockers, which are commonly carvedilol or metoprolol succinate, can actually increase your ejection fraction by 10 to 15% if we get the dose high enough. And then other meds that you may be on that are really important for your heart failure are ACE inhibitors or possibly angiotensin receptor blockers, which are another alternative to ACE inhibitors. These are real important. They will help you live longer and help you stay out of the hospital. They will lower your blood pressure. So I don't want you to think that we're giving them to you because we think your blood pressure is too high. Many heart failure patients will have a low blood pressure. And the reason we're giving you beta blockers and ACE inhibitors is to help strengthen your heart a little bit and to also help you live longer. They will lower your blood pressure, but I don't want you to stop taking these medications unless you are symptomatic with your blood pressure, meaning you're very dizzy or you're very weak. If you ever think that your blood pressure is too low for your medications, I want you to talk to your doctor about that. So we want you to be on the highest dose possible of these ACEs and beta blockers. However, there's sometimes reasons we can't give you these meds or that we may have to keep you on very low doses. ACE inhibitors, if you have kidney problems or you might develop a cough, those are reasons we might need to take you off of that. If it's just a cough, we can switch you to a different kind of med that ends in sartan, like losartan or valsartan, and that might be why you're on a different med than an ACE inhibitor. Your beta blocker, if you have a low heart rate, we may not be able to give you a beta blocker because it lowers your heart rate. So if you're not on a beta blocker or an ACE inhibitor and you have systolic heart failure, please discuss this with your cardiologist at your next office visit, but he can explain or she can explain why you may not be on these meds. So the next part I want to talk to you about is what can you do to control your heart failure? Because really the things that you do at home can make you feel way better than even the meds and the devices that the doctors might have you do. So there are 3 big things that we need to remember when leaving the hospital that you need to do, and no one else can do this for you but you. Number 1 is you need to be on a low sodium diet. And I want you to look at this booklet called the Congestive Heart Failure Home Care Instructions and Low Sodium Information, okay? The most important factor in improving your heart failure symptoms is a low sodium diet. The reason is because salt attracts water. And so salt will pull any extra fluid in your body into your bloodstream, which is going to go to your heart. And just like I showed you earlier, when you get fluid overloaded in your heart, it's just going to raise that fluid level and then it's going to go into your lungs and you will not be able to breathe. A lot of patients that come into my heart failure clinic, they may come to me and they're already on all the right meds and they have all the fancy pacemakers that they need, but they can't walk through Walmart, they can't make it to the mailbox, they've been having to prop up on pillows for years and years, and their quality of life is really affected. But we find that if they get on a low sodium diet, that they really will improve their symptoms, but you have to really pay attention. You can't just not sprinkle salt on your food. You have to actually change what you're putting in your mouth. Many patients will tell me when I talk to people all the time before they leave the hospital, but they'll say, don't worry, I'm already on a low sodium diet. I do not use a salt shaker. I don't sprinkle salt on my food. But you need to know that only about 6% of dietary sodium or salt comes from the salt shaker. Over 75% of the sodium in your food is already in the processed food that we eat. So it's really important to learn to pick different foods to eat and to avoid processed food like canned food, frozen food, TV dinners, fast food, things like that. A heart failure patient should not have any more than 2,000 milligrams of sodium a day. The average American gets about 3,500, the literature says 3,500 to 5,000 milligrams of sodium. I think it's probably a lot higher than that. But a heart failure patient cannot eat that much sodium. So most of you are going to be cutting your sodium content in half about. And you have to read labels in order to do that. The most obvious foods that you want to cut out are very salty foods, obviously, like potato chips, bacon, ham, canned soup, bologna, things like that. But you need to know there's lots of foods that have a really high sodium content that don't even taste salty. So that's why you have to read labels. For example, biscuits have 300 milligrams of sodium. Donuts can have 250 milligrams of sodium. Just a piece of cake can have up to 300 milligrams of sodium. It doesn't taste salty at all. A bagel can have 300 to 500 milligrams of sodium. Corn Chex, a cup of Corn Chex, 288 milligrams of sodium. Cornbread can have 450 milligrams of sodium. And ranch dressing, 200 milligrams to 400 milligrams for 2 tablespoons. And that's just a little bit of ranch dressing on your salad. So you really have to read labels, and you have to learn to try to eat different foods than you're used to eating. And if you'll look in the back of this booklet here, I have a lot of low sodium recipes. I have recipes for low sodium biscuits, low sodium cornbread, a vinaigrette dressing instead of doing ranch dressing. So there's lots of different things we can do. Also low sodium chicken noodle soup. But you have to tend to start to cook more things from scratch. Try to eat more fresh and frozen fruits or vegetables, and stay away from canned. So what I want you to do also, the next thing I want you to look at in your folder is the food diary, okay? This is a way you're going to keep track of your sodium content. So when you leave the hospital, the first day you get home, I want you to start writing down on this sheet of paper what you're eating for breakfast, lunch, and dinner. One sheet is one day, and this first one is a sample so you can get an idea of how to record all this. So I want you to record the sodium content of these foods, and the way you're going to find out how much sodium is in the food you're eating is you're going to look at the label on the back of your food. So anything that comes in a box or a can is going to have a label like this, and just look at the sodium content. And don't look at the percentage, just the milligrams, okay? And so we want to keep it to 2,000 milligrams per day. So if we're going to do 3 meals a day, you want to keep your meals to about 500 milligrams of sodium per meal, and then that leaves you a little bit of wiggle room if you have some snacks, okay? So, yeah, look at this sodium content, and then you're going to write down anything that has a label, write down that sodium amount right here. And anything that doesn't have a label, you can look in this booklet here, and starting like on the 3rd page, I have a whole bunch of foods listed with the sodium contents on them, okay? And so between those two things, you can keep track of your sodium content. And another thing I want to tell you, when you go grocery shopping, your first day home, or if your family's trying to figure out what they should buy for you now, a good rule of thumb is that when you're looking at foods at the grocery store and you're not sure which one to pick, look on the label and make sure that the sodium content is less than 250 milligrams a serving. If it has 400 milligrams of serving, put that food back on the shelf and try to find maybe a different brand might even just have a lower amount of sodium. But try to keep everything you buy to be 250 milligrams of sodium per serving or less, okay? The second thing that I want you to do when you go home is a fluid restriction. So the big three, number one is sodium restriction, number two is fluid restriction, okay? You need to remember that everything that you drink does not go directly into your bladder and into the toilet. Everything that you drink goes into your stomach and it gets absorbed by your bloodstream. And then your heart has to pump everything. It all ends up in your heart, okay? So heart failure patients, once you've been hospitalized with heart failure, it's time to start limiting your fluid, okay? Many patients will tell me, well, my doctor always told me to drink 8 glasses of water a day. That's great if you don't have heart failure, but just the same way sodium makes water be pulled into your bloodstream, too much fluid, if you're drinking too much fluid, it's just going to fill up in your heart and also back up into your lungs if you're drinking too much. So once you've been hospitalized with heart failure, we want you to keep track of the amount of fluid that you drink, and you're going to do that on your food diary here also. So I want you to write down under this fluid ounces column, write down how many ounces you're drinking with every meal and with all your snacks, and you also have to count the fluid that you're taking your pills with, okay? Anything, if it's liquid at room temperature, it counts. Coffee, water, milk, whatever, okay? I want you to have no more than 64 ounces a day, or 2,000 cc's, or a half a gallon. And truly, you'll find, I've had patients that, you know, they commonly are just in the habit of drinking about a gallon a day, and you get those big, like 72-ounce cups at Sonic, and they just drink and drink and drink all the time. When you have heart failure, this can be one of the things that is causing you to be short of breath all the time and unable to walk all the time, because it's simply more fluid than your heart can pump. Another tip that you can do is, like, when you're just sitting around at night and you're watching TV and you want to have something to drink, instead of having a big old glass, you can get a cup of ice chips and just suck on those ice chips, and it'll keep your mouth moist, but you won't get as much fluid overall if you just do ice chips. Okay, the third thing that we need to remember, so number one, low sodium diet. Number two, fluid restriction, no more than 64 ounces a day. Number three, we're gonna do daily weights every morning for the rest of your life. The reason that's important is that if you start to retain fluid and you're going into heart failure, your weight will go up fairly quickly, okay? So you may gain 2 to 3 pounds in a day, or up to 5 pounds in a week or more. You may gain 10 pounds in 3 days. So that's why it's important to weigh every morning. Empty your bladder in the morning and just wear your same pajamas, whatever. Just keep it consistent every single morning. Do not weigh again in the evening. Everyone gains weight throughout the day, so we only want to compare morning weights to morning weights with the lowest weight possible after you've emptied your bladder. So then I want you to look at this. This is in your packet. This is the heart failure stoplight, okay? And this is going to make sense after you are weighing every day. So this is going to help you keep track of when you're getting into trouble, okay? So the green zone here means that you're weighing every day and your weight is stable, and it's normal to fluctuate, you know, maybe 2 or 3 pounds up and down. That's fine. But and you're breathing okay, and you're swelling in your legs or whatever is not out of control. What we want to pay attention to is the yellow zone. When you get into the yellow zone, that means you're starting to retain some fluid. And if you're able to catch it at the yellow zone and you can call me or call your doctor, then usually we can adjust your meds, or I can get you into the heart failure clinic, and we can turn this problem around without a trip to the ER. But you have to pay attention to when you get into the yellow zone. So you're weighing every day. You are in the yellow zone if you have gained 2 or 3 pounds suddenly overnight, and then maybe the next day you gain 2 more pounds and the weight is just going up, 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 or up to 5 pounds or more in a week. You may also have, you probably will if it's fluid, you'll also have more trouble breathing. Lots of times the first symptom is that you cannot sleep laying flat. And you used to always sleep with 2 pillows, now you're using 3 and 4 pillows so that you can breathe okay. You may also have a wet cough. You may find that you're more short of breath when you just walk to the bathroom, along with a weight gain. So when you start to have these symptoms, I want you to do what this sticker says right here, and these are the phone numbers that you're going to call. If you are enrolled in the heart failure clinic, I want you to call me at the heart failure clinic at 501-978-8633. Okay, if you are not coming to the heart failure clinic, I want you to do what the sticker says here. So you're going to call Arkansas Heart Hospital Clinic at 664-5860. If you have a problem over the weekend, and frequently this happens, it'll be Saturday afternoon and you realize your weight's going up and you can't breathe, what do? You do have an option other than just going straight to the ER. If you call on here, it says the medical exchange is 663-8400, 8400. You can call the medical exchange from 5:01 p.m. on a Friday up until 7:59 a.m. on a Monday morning, and just ask for the doctor on call for Arkansas Heart Hospital, and you will get a cardiologist all throughout the weekend. So if you find that you're getting into the yellow zone, I want you, and it's on the weekend, call the medical exchange, and then the doctor will tell you what to do. Now, if you don't catch that you're in the yellow zone, if you're not weighing, and if you're not keeping track of your sodium, you may wake up one day and realize, and it's usually at 2 a.m., realize that you can't breathe at all. And lots of times you're up 20 pounds and you didn't know it because you weren't weighing every day. That's the red zone, when you get to where you can't breathe at all. You may have chest pressure, it's very scary, and you pretty much just have to go to the emergency room because you can't breathe, okay? But, and so if you get to this point, if you can't get a hold of your doctor or someone right away, you probably are going to need to go to the emergency room or call 911. But with heart failure, the whole point of having good outpatient heart failure management, most heart failure should be well managed in the outpatient setting. It's not like a heart attack or a heart arrhythmia that just strikes out of the blue and you had no idea. When you have a heart failure buildup, you generally have some warning. You'll know that your weight is going up. You'll know that your symptoms are getting worse. And if you can call as soon as you start to have those problems, then we can keep you out of the hospital. But if you don't call and you think you can walk this off or it's just going to go away, you will rapidly advance to the red zone and you will end up in the emergency room where you don't want to be. Okay, so we know statistically that when people come into the hospital with a heart failure exacerbation or like a heart failure flare-up where you're overloaded with fluid, statistically about 1 in 4 of these patients are going to be right back in the hospital within 30 days. So that's why it's so important to do those 3 things that I was talking about: low sodium, weigh every day, and fluid restriction. There's some additional things that you need to know about. I want you to know that alcohol worsens heart failure. We do know that alcohol will kind of bog the heart down a little bit more. Alcohol can, in large amounts, like with alcoholism, can just flat out cause heart failure, even in the absence of a heart attack or anything else. And so if you're trying to do everything you can to improve your heart failure, I really recommend that you abstain from alcohol. It's also important for heart failure patients to quit smoking. If you quit smoking, you will have a 30% lower rate of death than heart failure patients that smoke. Another important thing to remember, you need to avoid over-the-counter pain relievers except for Tylenol. What we call NSAIDs, non-steroidal anti-inflammatories, drugs such as Motrin, ibuprofen, Aleve, Advil. All of these meds can blunt the effects of your diuretics, and they can make you retain fluid and go to the ER. So if you're having chronic pain, please discuss pain management with your doctor. When you're leaving the hospital, I want you to pay really close attention to your discharge medication list that your nurse will give you. Usually when you've had a hospitalization with heart failure, it's common that medications will be changed. Pay close attention, especially to your diuretics. If you don't pay attention and you keep taking the same dose of diuretics and your doctor has increased the dose or decreased the dose, and you don't ever look at your med list and keep taking the same dose, you can end up right back in the hospital with fluid overload or with dehydration. So we want to be really careful. Another important thing to do is use a pill box. Heart failure patients frequently are taking 10 different pills or more a day, and it can be very difficult to keep these straight. And if you take your pills wrong, you can have disastrous consequences such as not being able to breathe and ending up back in the ER. So what I really recommend is, if you have any difficulty at all, I don't think I could keep 10 pills straight a day, is to put them in a pill box, or have a family member help you with your pills. And like a daughter or someone, they can just come over once a week and fill up your pill box for the week. And then you just take them out of there, and that takes all the wild cards off the table. Then we know you're taking your pills. If you think you might have forgotten a pill, you look in your pill box. If it's still there, you didn't take it. So that's another really important thing that you can do to stay out of the hospital. So that's it. This concludes your CHF Hospital Discharge Instructions, and I want you to remember that knowledge is power. Heart failure can be a very difficult disease to manage, but you'll soon learn that the more that you learn about this disease and the more that you're able to take control of your lifestyle with diet changes and doing the fluid restriction and being able to identify when you're getting into trouble early, then you'll be able to feel better. You'll be able to live more independently and participate in activities that maybe you couldn't do before. So I also want you to know that your healthcare team at Arkansas Heart Hospital includes your doctors, the nurse practitioners, the nurses in the hospital, the dietitians, your heart failure educators, and myself, and the outpatient Strong Hearts CHF clinic, which is located at Arkansas Heart Hospital Clinic across the street. We are all here to support you on your journey back to better health. If you have any questions, please ask us. And we wish you all the best as you leave Arkansas Heart Hospital and return back home. Thank you very much.